I was actually asymptomatic, but my primary care doctor heard a murmur, and she wanted me to explore this with Dr. Campbell. He did some testing and decided I needed to have minimally invasive valve replacement. I thought I was totally asymptomatic, but after the surgery, I realized I had much more oxygen and much more energy, and I was able to do more things better than I had in the months preceding the surgery. This totally changed my perception of the surgical opportunities for a patient and for the excellent care that you can get from doctors in this area.